Hello, I'm Dr. Chris Good at the Virginia Spine Institute. I'm a spine surgeon, and I'd like to welcome you to our celebration leading up to World Spine Day coming up this Friday. Exciting every year to just take a minute and celebrate the advancements in our field and really recognize people who've been able to overcome and deal with their spine problems, or at least work to get to the best possible quality of life despite what they're dealing with. And so really I wanted to say hello to everybody. Thanks for watching. I'm excited today because I'm going to take you a little bit behind the scenes on really exciting technology. We were recently performed one of the first surgeries in the world using augmented reality, and the first in our region. Augmented reality is really exciting technology that is becoming commonplace in our world, and using this system, it's made by a company called Augmetics, called X-Vision, is actually the first application of augmented reality in the field, any field of surgery, not just spine surgery, but all surgery. And so this is really a tremendous evolution, and these spine type of procedures for people who do need them are not the surgeries of the past, and a tremendous evolution in what we've been doing over the last 10 years and 20 years. And many people who've seen me talk before, know that I'm passionate about this. I have both of my parents have had spine surgery, and my dad actually fell out of a chairlift when I was 10 days old. And back in the 70s, the options they had to try and help him, fix him, were very limited. And he ultimately underwent a surgery that the spine was not able to mend or heal together properly, and this led to kind of one problem after another. And so I grew up, as a kid, kind of dealing with this and know firsthand. And ultimately he did pass away as a result of one problem after another when I was in 6th grade. And so while that story makes me sad, it also is really inspiring to think of how different someone's path would be today with a similar type of injury. And in fact, we now take care of people with similar injuries who we're able to get them fixed and get them up and around and moving and back to their lives. And so, where I was kind of saying, this isn't your father's spine surgery. Augmented reality is another step forward for me, and if we think about what augmented reality means, people are AR, VR, what is all this? So virtual reality, which is the kids' video games, is a headset where once you put it on, your reality is completely replaced by something that comes from the computer. So you're surrounded by artificial pictures, and you really aren't able to interact with the world around you. Augmented reality is different. Augmented reality, you're still able to see and interact with the world around you, but additional information is brought up on the screens. And so I think one great example of this is, if you think of your fighter pilot, up in a dogfight, they're looking out the window. They're looking for the other pilots. They're watching their mountains and the things around them directly. But they also have a heads-up display in front of them, which is showing them their airspeed, their targeting, and all this information is happening. So they're actually able to see what's going on around them, but have this additional information that's brought up in front of them. And so that's augmented reality, meaning that it's augmenting or making better what we're dealing with in our own reality. Now, we're using this in spine surgery. We're using this to actually be able to put on a headset so that as we're operating and doing a surgery, we're able to see the patient and we're able to see their anatomy and their body, but we're also able to superimpose scans, like CT scans, that are done prior to surgery. And so it's as if we're having X-ray vision as we're working. Not only we're able to see the patient, but we're able to see the scans and work inside the body. And this has two huge benefits. One is to be able to do minimally invasive surgery, where instead of having to cut the skin open and open things to look in visually, I can actually see through the skin using this situation and work through little incisions, never even cutting the patient open to fix the problem, minimally invasive. Another great application is if somebody has a really complicated surgery and really challenging anatomy, this can be a way for me to get a lot more information on how to do this surgery safely. And so, if I'm driving in the city for the very first time and I don't know, where I'm going, and there's traffic jams going on, being able to turn on your navigation system as you're driving and have that assistance can really help us, particularly in more challenging surgical procedures that we do. And so Trent Peterson was good enough to share his story, and he was on the news last week. Trent had the first surgery in our region with augmented reality. I'm ecstatic to say I actually just saw Trent a couple of hours ago, and his bags are packed, and he's on his way back to Minnesota. And so he's gotten through his surgery. The augmented reality was a very successful part of his surgery, and more importantly, Trent's doing awesome. His progressive nerve damage has stopped, and now he's getting back home to continue recovering and getting back to his life. Now, if we look at the potential benefits of why we might want to do this, we know that when we do spine surgery, we're doing very delicate work. And many types of medical procedures are very delicate. Surgeons are working around nerves, they're working in the eye, they're working around the intestines. And to be able to do delicate work very safely and accurately can improve the chances of success for a patient. And when we're doing spine surgery, it's very critical that we hit a bullseye every time, because we're working in this area where we're surrounded by very delicate structures. And so being able to use advanced technologies, and augmented reality being the most recent one, allows us to not only have better precision or accuracy during our surgeries, but therefore to lead to better success or better outcomes for our patients. Because if we can be more accurate, we can have lower rates of complications, lower rates of troubles after surgery, and ultimately get people better faster, and ideally through smaller and smaller procedures, again, because we're not having to open up the body and look in there with our eyes. We're actually able to do that using technology and achieve the same goals within the body of doing the surgery without as much disruption to the body to get it done. So Trent's story has been very inspirational, and I do think we'll have him out as a follow-up once he gets a little bit further along. He's sending his best to everybody. For me, I really think that it is exciting to talk about these things and share the passion, because spine surgery is scary, especially if somebody is getting to the point where they're starting to consider the need for this. And in any type of surgery is scary, and we're always trying to figure out, how much is this going to hurt? How am I going to recover? Is this going to help me? And being able to use these type of technologies can allow us to do better surgery for people, less invasive, higher chances of success. So with that, a couple of questions coming through, so I'm just going to scroll down. One question, will AR become common with all spine surgeries or only some of them? I actually think that AR is going to go way beyond spine surgery, and while we're excited that the first use of it was in our area, I think there are an almost unlimited number of times when a doctor is taking care of someone and they need to be able to see the patient, but they also need some additional information. And instead of having to go look at a microscope, look at a scan, look at a chart, to be able to bring that all together so that we don't ever have to take our focus off of the patient as we're working on them can be really helpful. So I actually see this in a number of different fields, going beyond spine surgery, brain surgery, eye surgery, and I think that this application is going to grow. In terms of spine surgery, I think most surgeries would fall either into a category of minimally invasive or a more traditional surgery, and that usually is because of something more challenging with the anatomy. And so I do think as our experience builds with this, it will be something that is used very commonplace for many, many different types of spine surgery. Now, there's lots of different types of spine surgeons and lots of ways to go about this, lots of different tools that are available. And so it's always about, if you're a surgeon, it's about trying to figure out within what's available to you, what is the best way for you to help a particular patient. But what I love about working with systems like this is if we can develop something that truly is a game changer, that truly improves all surgeons' accuracy and precision, then that's a way that we can actually help thousands of patients we've never even met by bringing something out across the world that improves care for everyone. Another question, is augmented reality currently available across the country for spine surgery? Well, no, this is very new. So, to my knowledge, there are around 5 or 6 places where this is kind of being started, and those are with some of the doctors who've really done some of the initial work developing this. I think that what we are going to see, though, is that this is a technology that is very user-friendly. It's very easy for surgeons to learn and adapt this technology. Some advancements that we have, it's really hard for doctors to learn a new way of doing it. It takes a long time to catch on. I think this is something that is a huge value addition, and it's better for surgeons immediately. And so I do think we're going to see this exploding around the country, and that's a big part of what I'm hoping and excited to be a part of is not only using this for my own patients and the people that I'm taking care of, but working to help and train other surgeons and help to expand this. And again, I see that as a way that we can reach so many more people beyond the patients that we can care for ourselves. Comment from one of my patients: thank you very much. Advancing spine surgery and for patients to regain their life. So not a question there, but that comment means a great deal to me. So thank you for watching, and I really appreciate it. If you are interested, or certainly if you're looking at a type of procedure, I think that the most important thing is the relationship between the patient and their doctor. And I think that is more important than any piece of technology. And so if people are undergoing these types of care, it really is the decisions that you make with your doctor and that relationship that is more important than anything. Beyond that, I do think that these tools and technologies can help to bring all of us to a higher level. And so if you are thinking you may need a spine surgery, really learning about how your surgery can be improved, what type of surgery, and how could these different technologies perhaps improve your chances of success with surgery is really important, and that's something that I think more and more we're trying to have that out on the internet and make available to people and more surgeons as time goes along. So with that, I'd really like to thank you for watching. I hope this is interesting. You can catch Trent's story from the news the other day. And I'd like to invite you all to turn in tomorrow at lunch. Dr. Gizzini is going to talk a little bit about recovery after spine surgery as we're leading up to World Spine Day. And again, thank you very much.